Healthcare payment solution provider CarePay has rolled out a mobile-based saving platform in partnership with telecoms firm Safaricom, targeting Kenya's low-income earning group. The service, dubbed M-TIBA, will see individuals make regular saving to the mobile wallet, and the custodian of the funds is the recently merged financial services provider UAP Old Mutual Group. Joining us to explain how this is a game changer in the Kenyan health sector is Kees van Leyden, the COO, the Chief Operations Officer at CarePay. Thank you again for making time, Kees. Let's just begin all of this off with a simple question. Do you get the sense that the mobile money space or mobile payment solutions in sub-Saharan Africa are nearing saturation?
No, I don't think we're even close to that. We're only at the start. Kenya is obviously the country that's cited the most for their mobile money revolution that they started through M-PESA and now also other competitors in the market. But I think we're just scratching the surface. I think we are one of the many solutions that you see that are building on top of a mobile money industry that is reaching almost all Kenyans and more also other Africans in the countries around us. So I only think we're at the start, and M-TIBA, which we are working on, is only one of those many services that can be built on top of an active mobile money landscape.
Right. Much of the focus that you are going with is low-income earners. Wouldn't you argue that maybe there is a gap at the top too?
Definitely, and I think you're basically undercutting what we're focusing on, because we're focusing on much more than only the low-income earners. If you look at a market like Kenya, 2 out of 5 Kenyans forgo medical care because they can't pay for the healthcare services that they need, and more than 50% of healthcare spending is out of pocket. And we also know that the majority of Kenyans is uninsured for healthcare. So we're not talking only about the low-income groups, we're talking about actually the majority of Kenyans. And yes, we are focusing on those groups because we think there the biggest gains can be made in terms of healthcare financing. So today is also a very happy day for us because we're announcing that already 45,000 M-TIBA users have registered only in a few months' time, which can now access services at 60 healthcare providers in Nairobi and a growing number outside of Nairobi. So today was also the announcement of our nationwide rollout. So I think it's a great day for us, but more importantly for all those Kenyans who now don't have an ideal solution to pay for their healthcare needs.
Kees, this is without a doubt a very interesting development when it comes to the healthcare space on the east of the continent. So when these principles are collected from the low-income earners, are there investments made, or is this money that goes in a coffer somewhere and collects dust?
Yeah, very good question. Basically, I think we've come up with quite a creative first product to launch with, and there will be many more to follow. What we started with is actually a savings product combined with a small insurance product. That's why UAP Old Mutual, obviously one of the most reputable financial groups on the continent, is the custodian of those funds, but also the underwriter of the insurance component of the product. So as soon as a person registers on M-TIBA and they save their first 100 shillings or more, they immediately get not only a 50 shillings top-up straight cash into their M-TIBA balance, but also they get a personal accident cover that covers themselves and their spouse for a full year. We really chose this combination by intention. As the previous speaker actually already mentioned, health insurance doesn't have a good reputation yet in Kenya. We do think that in the end it's better for people to insure themselves, but we also realize that a lot of people don't have the means to do so. So therefore we chose for a savings product that gives direct cash incentives when people hit certain goals or milestones, combined with their first, for most people at least, their first insurance product ever, to at least experience what that extra protection can mean for them and their families.
Kees, looking at your partners, of course I'm seeing M-TIBA going the way of Safaricom, also partnering with Pfizer, global powerhouses, yes, juggernauts to say the least. But wouldn't one argue that in the future you should be looking towards public-private partnerships, especially on a continent or even a region where much of the healthcare being provided by the government is almost non-existent?
Thanks for that question, and it's a really important topic. We've been in very close contact with the Ministry of Health in Kenya on the development of this. They've been very supportive so far, which is great. It's good to realize that 50% of all healthcare in Kenya is actually provided for by the private sector. So while public is very important and a crucial piece of the puzzle, it's also important to realize that private plays a very important role. So that is actually where we started with the clinics that we've been enrolling so far. Having said that, yes, we are already in discussions and would love to bring also the public facilities on board, because this is about healthcare inclusion, as we call it. The previous speaker spoke about financial inclusion in Tanzania. We want to raise the bar here and already talk about healthcare inclusion. And that is something that even with those powerhouses that you mentioned, even with a partnership like that, you cannot achieve that alone. Public is a very important part of the puzzle, if not the crucial one. One concrete example of where we are already talking very closely about cooperation is the data that we gather. On every transaction on M-TIBA, we collect very valuable data on the treatment, which we feed back to the healthcare providers so they can improve the quality of their healthcare based on tangible data. But the same we can do towards the government. Currently, it's very hard for the government in Kenya to get reliable data back from the private healthcare sector. And that is one role we can help them with by providing timely and also accurate data on what is happening in the field, which is really crucial for public health intentions as well, of course.